Dear bariatric surgery patients, you're truly wonderful people and we feel very happy to be part of your journey. Being able to witness your happiness 1 year from now makes what we do even more meaningful for us, both professionally and personally. I would like to highlight that the most important part of your journey actually begins after your surgery. Your compliance with the diet, your level of activity, and your communication with our team will help you go through this process in a much more comfortable way actually. As a reminder, your detailed timeline will be shared with you 15 days before your arrival. And one of the most common questions we receive is about the hospital stay actually. So let me explain that part. The first night covers your pre-operative preparation, and the second and third nights are for your recovery actually. So your total hospital stay will be 3 nights. Once you arrive, after your initial welcome, your hospital admission will be completed and your pre-operative preparations will begin. And our field coordinator team will meet you and guide you through this process. Nurses will come and ask for your medical history again, including any medications you're using, and then your blood tests will be taken, a chest x-ray will be done, and if your timing allows, consultations with doctors from other specialties will be arranged to evaluate you individually. One of the most common concerns is, what happens if something comes up during consultations and I cannot have the surgery? So, if your surgery cannot be performed, consultation and hospital accommodations fees will be deducted and the remaining amount will be refunded to your side. So if you prefer, our coordinators can assist you with hotel arrangements or reorganizing your flights. If it is a temporary condition, once your treatment is completed, a new operation date can be planned. In some cases, if additional conditions such as gallstones or hiatal hernia are identified and require treatment, they can be treated during the same surgery with a small additional cost. In such situations, all medical reports, such as ultrasound results, will be shared with you. In some cases, depending on your condition, your surgeon may prefer not to combine these procedures. In that case, your current treatment plan will continue as it was planned, and you may be advised to complete the additional treatment in your home country without any extra charges here. And let's talk about the day of your surgery. You will usually be able to stand up within 4 to 6 hours and start liquid intake after about 8 hours. Unless there is a specific medical need, we generally do not use urinary catheters or drains in bariatric procedures. This actually helps our patients recover faster and feel more comfortable during this process. And one of the most common discomforts after surgery is gas pain, so let's talk about that. During the operation, a medical gas is used to allow better visibility for your surgeon and movement inside the abdomen. So this gas is naturally released through movement and nutrition, which is why early mobilization is very important after your surgery. Getting up and moving early will help your body recover faster from both anesthesia and surgery. When we ask our patients to rate their pain from 1 to 10, we usually receive feedback around 7 in the first few hours, which decreases to around 3 within 6 to 8 hours actually. As mentioned earlier, you're never alone during this process. Our medical team will always be close to you, either just outside your room or right beside by your bedside. The day after your surgery, with both IV and oral support, you will actually start to feel much better. If you feel ready, your dietitian will explain your nutrition plan in detail to you, and your protein supplements and vitamins, which are included in your package, will be provided to you. Your dietitian will continue to support you with regular follow-ups and will contact you before each stage of your nutrition process, including liquids, puree, and solid phases. You can also reach out anytime if you need support. We also recommend following your patient booklets regularly, as it will guide you throughout this journey like a personal assistant. On your discharge day, your coordinator will explain how to use your medications according to your surgeon's instructions. You can always ask additional questions you may have. For your comfort and safety, we usually recommend staying in the country for 1 or 2 more days after your discharge. If included in your package, your transfer to the hotel will be arranged, and as noted in your timeline, your transfer will pick you up from your hotel approximately 3 hours before your flight and take you to the airport. For any additional details, your coordinator, your medical consultant, and all the team at CK Health will always be there to assist you. Wishing you a smooth journey. Bye-bye.